Most of the time when patients come and see us for treatment for hyperhidrosis, it's usually for sweating of the underarms, but you can actually do botulinum toxin treatments for sweating on the top lip, sweating on the forehead, really sweating anywhere, but the commonest area that would treat would be the underarms. For a hyperhidrosis treatment, if somebody's coming for their underarms, usually what we do is we do an assessment first, and you can do a test called a starch iodine test, where you just actually sprinkle a bit of corn flour and put a bit of betadine on the armpit, and where the patient sweats you see purple colour change, and then you can mark out that area. So once you've done that, you know the area that you need to treat. The standard dose that we use when we're using botulinum toxin is approximately 50 units per side. So it's 100 units in total, and that's quite a large dose, but it's very effective. It actually stops patients sweating from the underarms completely. And the effects often last for 6 months and sometimes even longer, so they get really good long-term benefit from it. So most patients are only doing it once or twice a year. Patients worry that they'll sweat more from other areas, but that doesn't happen because the sweating that you get under your arms is non-physiological. It doesn't really serve any particular purpose. It's just for whatever reason, whether it's stress or anxiety, patients sweat more from that area, and there's no evidence that they sweat more from other areas after the treatment. And it's actually a very well tolerated treatment. It has very few side effects. It's actually a pretty easy area to inject. I mean, the difference when we're doing a hyperhidrosis treatment is that if we're using botulinum toxin for wrinkles on the face, for example, we're actually injecting into the muscle, so it's a slightly deeper injection. But when we're injecting for sweating problems, we actually are injecting into the skin. So it's a very superficial injection, and so for that reason, there's minimal swelling. Sometimes you can get a little bit of bruising, but there's not very many side effects at all, and it doesn't have any impact at all on the muscles in the arms or the muscles in that area because we're only treating the skin. You can treat the palms of the hands, you can treat the soles of the feet. Women particularly are bothered by sweating on the face, and that's more common in postmenopausal women. So you can do low dose treatments on some of the areas on the face to stop sweating. If we're treating the hands and the feet, unfortunately, that's another treatment area that requires quite a large dose, and you do need to apply some form of anaesthetic cream before the treatment because it's a little bit uncomfortable because you do need a few injections. Most patients are suitable for the treatment. There's a few medical conditions and a few medications that might interfere with their ability to have the treatment, but most people can have it. And this is one of the few treatments that we do that we might treat adolescents or teenagers because they often present, 15 and onwards with sweating that they actually find very socially embarrassing. Usually they would come along with their mum or their dad, and we'd discuss it with both of them before we treated somebody of that age. It is a slightly more expensive treatment just because of the volume of toxin that's required. Unfortunately, if you don't use an adequate dose, you just don't get anywhere near the benefit. So if patients can afford it, they are actually better off having the recommended dose. The other thing about having the recommended dose is the treatment lasts longer. You might only get a short period of improvement, so it's actually financially not really worthwhile to do a lower dose treatment. But these patients are often spending a fortune on clothing and dry cleaners and changing their shirts all the time. So, most patients really suffer with this sort of condition. So for them, it's worth it.